A pilot program that pairs Metro police officers with mental health clinicians just passed the halfway mark in its first year. Leaders say the numbers so far show there is great need for these services. Nicole Smith joins us in studio with a closer look at that.
Hey, good morning, Neil. The program is now operating in 2 Metro Police precincts, and leaders say based on the data so far, they will be expanding. The North and Hermitage precincts were selected for the pilot because of their high call volume related to mental health service. There are 6 counselors from the Mental Health Cooperative who volunteered, and 16 Metro police officers received specialized training in mental health, suicide prevention, and de-escalation. Metro's Emergency Communications Department is also a major part of this process because their dispatchers are taking the calls for service in the first place. They've dispatched a co-response team about 1,500 times for qualifying calls in the past 6 to 7 months, and of those, about 800 did involve a mental health crisis. There also seems to be an equal need in both the precincts. Most of the responses so far originate from the dispatchers, but also from fellow officers.
There are some calls that are coming in from other officers. They get to a scene, it wasn't originally dispatched that way, and they recognize, hey, this is a mental health issue, and they're calling for the co-response team in their sector to come assist them on the scene.
Each team has a master's level clinician and an officer. Once the scene is stabilized and no longer a physical threat, the clinician can assess the person in question. Here's Metro Police Inspector David Emhoff, who heads the Office of Alternative Policing Strategies, talking about the program during its quarterly update.
We have a lot of officers to train, and I want people to understand that, when they go through, officers go through, the volunteer for this program, they went through 40 hours of crisis intervention training provided by a mental health co-op. And our hope is we're very close to being able to embed a mental health cooperative clinician at our academy to continue with training those officers.
After the first 7 months, the plan now is to expand. I'll have more on that coming up in the next half hour. We also want to remind you that there is help available where you don't have to go through 911. The Mental Health Co-op's crisis line is available 24 hours a day, 7 days a week. The number is 615-726-0125.